Most of us experience pain at some point in our lives. If you or a family member sustains an injury or suffers from ongoing pain, your doctor, dentist, or other healthcare provider may prescribe strong pain medication, including opioids. Some opioids such as hydrocodone, oxycodone, codeine, and morphine are necessary to treat pain. Sometimes they are not. So it's important that you know the risks that come with the use and misuse of these medications. Before you agree to take what the doctor has prescribed, you have a right to ask questions and know why the medicine is recommended.
And is that considered an opioid?
Why do I have to take it?
Are there any other options that have less risk?
Opioid medications are used to reduce moderate to severe pain as a result of an injury or accident and could be helpful for some patients who live with ongoing pain. But all medications come with side effects and risks. The side effects and risks associated with opioids can be extremely harmful. That's why it's important to know the facts about your prescription. Ask questions about the benefits, risks, and side effects, and talk to your doctor and share any concerns.
I know they can be pretty powerful. What are the risks to my son? What can we expect?
When used appropriately and for a short period of time, prescription opioids can help manage severe pain. However, opioids carry a risk of reducing someone's ability to breathe, especially if that person has never taken an opioid before. It's called respiratory depression, and it can lead to a fatal overdose from opioids. So the selection of the type and dose of an opioid is important. At high enough doses, long-term use of any opioid causes physical dependence. This means patients experience withdrawal if the medicine is abruptly stopped. Some people may also develop an addiction to the medication, meaning they continue to use despite harmful consequences.
As soon as we're ready, we'll have your discharge papers and you'll be good to go.
Wait, Doc, I got a few questions about the prescription.
What are your concerns?
Why do I need to take this?
Opioid medications are just one of many ways to treat pain and should only be used when necessary for as long as necessary.
I'd like pork chop medicine.
Have a candid and open discussion with your physician about the benefits of opioid medications, as well as the common side effects and risks of addiction or overdose. Together, you can make educated decisions on the safest and most effective treatment plan.
Are there any alternatives to managing his pain other than taking this?
Your doctor should be able to provide a variety of suggestions and medications on how to manage your pain. Don't be afraid to speak up. Ask your doctor about alternative medications that do not contain an opioid, or if there are options that don't involve medication that might help. Some of these options may actually work better for you and have fewer risks and side effects. Also, ask about combinations of options, since combining medication and non-medication treatments can work better than just one alone.
He likes to have some wine with dinner every night. Is that okay to do while taking an opioid?
Take precautions and avoid combining opioids with alcohol and certain other medications such as anti-anxiety medication or muscle relaxants. Taking more opioids than prescribed, using other opioids such as heroin or illegal fentanyl. Prescription opioids carry serious risks of addiction and overdose, especially with prolonged use.
Hi, how you doing?
If you're experiencing pain or planning for a procedure or suffer an injury, be prepared by writing down your top questions about opioids or have them handy on your phone. Questions such as, is this prescription for an opioid? Why do I need this? Are there other medications I can take instead?
How long should he take the medication? When should he stop? Once the bottle is empty, or if he's feeling just a little better? Or...
Ask your doctor to prescribe the lowest dose and smallest amount you may need and find out when to follow up on how it's working. When you visit your doctor, it helps to bring along an advocate such as a friend or family member who can jot down notes, listen to the conversations, or ask any high priority questions.
Physical therapy, exercise.
Well, what about the other medications you've given me?
You know, that's a great question. So do these pain medications interfere with his current medication?
It's very important that you tell your healthcare provider about all the medicines you are taking, especially those prescribed to treat anxiety, sleeping problems, or seizure. Include any over-the-counter medicines you may be taking. Even medicines you only take occasionally could interact with the opioid pain medication. So ask your healthcare provider about possible interactions. Together, you and your advocates should trust yourself to ask important questions. Speak up even if you disagree with the doctor, and make sure you don't leave without getting answers to your most important questions.
Well, thanks for answering my questions, Doc.
Play it safe and ask your healthcare provider questions before taking opioids.
Thanks for taking time to hear my questions and answer them all. Thank you. I appreciate it.
No problem. Happy to help.
Empowered with this knowledge, you can partner with your doctor and ultimately make the best healthcare decisions for you or your family members. Learn more about opioids to protect yourself and your loved ones from opioid misuse, addiction, and overdose. Visit stopoverdose.maryland.gov to find important questions to ask your doctor before taking a prescribed opioid.